Okay, so the exact status of vaccines, COVID-19 changing by the day. So we're going to bring in Dr. David Winter from Baylor Scott White Health for our weekly chat. Hello, good to see you. How are you?
Hello, Sonia. Always good to be with you.
Thank you. So I've got some, viewer questions lined up here. I want to just get right to them. The first one is from Ashley, who asks, if I am vaccinated, is it safe to be around babies that cannot be vaccinated? This is a good question.
It is. It's important to know that the 3 vaccines in this country that are being distributed do not contain a live virus. So if you get a vaccine, you cannot give the coronavirus to anybody else, including babies. So yes, it's safe.
Okay. We've got a question from another Ashley, and so let's get that one up. And this one asks, does the vaccine cause infertility problems? And I know this has been a very big question for a lot of women.
There is still no evidence that that is true. In fact, the American College of Obstetricians and Gynecologists is encouraging women thinking about getting pregnant to get a vaccine. They're worried that if you're pregnant, you may not do as well with the COVID-19 disease. So they're encouraging that. And fertility experts are saying, if you're getting fertility treatments right now, go ahead and get a vaccine. It's not going to affect fertility.
Okay, that's good to know. Charla's question, as we are seeing a high percentage of people having fairly robust reactions to the vaccines, does having these reactions guarantee that the vaccine is working for them? And Charla works in healthcare, so I like this question from her.
Well, when you're having those reactions, sore arm, fever, chills, fatigue, that means your immune system is building antibodies to help attack any coronavirus that you may come in contact with in the future. So I think it's a good sign. Now, some people have minimal symptoms or no symptoms. They still build up antibodies. So we're not sure it makes a big difference, but the fact you're having symptoms is not a bad sign, Sonia.
Okay, let's get Candy's question up here. If you are fully vaccinated, is it possible to catch COVID? And if so, at what point will it be okay to not wear a mask? Maybe we should talk, Dr. Winter, a little bit about, wearing a mask even after vaccination.
Yeah, it's important to understand that what the vaccines give you is a good protection, highly effective at preventing severe COVID-19 symptoms, but preventing having to go to the hospital with COVID-19, or most importantly, from not dying from it. They're very good at that. Now, you can still get a mild case of it or no symptoms at all. You can still have that and still spread it. That's why we think we need to continue to wear masks until we have more people in this country that are immunized.
Okay, Dr. Winter, our final question here. What will be the best estimate for life to go back to normal? I feel like I get this question every week. I'm sure you get it every day. So I'm going to ask you to take out your crystal ball this week and tell us the answer.
Well, that's a multi-million-dollar question. And here's what the scientists are saying. It's going to take 70 to 80% of the population to be immune to this, meaning you've had a vaccine or you have antibodies from having had the disease itself. Now, the current trajectory shows that's probably going to be mid to late summer, maybe early fall, so it's coming. But in the meantime, we need to continue, Sonia, as you know, to mask, distance, and disinfect our hands.
And I think I just want to make, one more point on top of this all. People ask, which is the best vaccine to get? Really, it's the one that you're being offered.
There you go. They're all good. You got it.
All right, Dr. Winter, thank you. Good to see you.
Thank you. Good to see you.